Your Excellencies, distinguished guests, ladies and gentlemen, welcome to the 6th Singapore-Shanghai Dialogue on Urban Governance, Planning for Healthy and Regenerative Cities. My name is Ting, and I'll be your MC today. It is my honor to now introduce our esteemed guests and speakers who will form the dialogue on urban governance, planning for healthy and regenerative cities. In attendance with us here today, we have Ms. Ling, Senior Minister of State for Ministry of Trade and Industry and Ministry of Culture, Community and Youth, Chairman of Mayors Committee and Mayor Southwest District. Also, we have Mr. Chen Jian, Vice Mayor of Shanghai Municipal People's Government. We'd like to thank you for gracing our event today. Also, a very warm welcome to our speakers, Dr. Daxiang, Director General of Shanghai Municipal Health Commission and Director General of Shanghai Administration of Traditional Chinese Medicine. Dr. Dan Wen-Mui, Director of MOH Office for Healthcare and Transformation. Dr. Zhang Yonggang, Deputy Director General of Municipal Commission of Housing, Urban Rural Development and Management, and Director of Shanghai Urban Management and Law Enforcement Bureau. Last but not least, we have Mr. Patrick Yap, Director, RSP Architects, Planners and Engineer, who will be representing the Singapore Green Construction Development Alliance. Without further ado, we would like to welcome Senior Minister of State to deliver her opening address. SMS Low, please.
谢谢大家，不好意思让你们久等啊，因为其实呢，我在昨天呢，我和陈市长我们就出席了这个世界城市峰会，一起共进午餐，而且在世界城市峰会呢也坐在一起哦，互相学习。然后我们说了，今天在这个参加这个大会之前呢，我也希望和他做更就是详细的一个分享和交流，所以我带了几位会长哦和院长，就我们刚才3点聊的有点忘记时间，不好意思，聊的忘记时间的意思。其实新加坡和上海呢，其实在方方面面都有很多合作的契机。非常尊敬的上海市陈宇健副市长 ，Mr. 陈宇健 ，Vice Mayor of Shanghai, Excellencies, friends from overseas, a very good afternoon to all of you, and we are very, very happy to join you at the 6th Singapore-Shanghai Dialogue on Urban Governance, and a very warm welcome to all the friends from Shanghai and around the world. 不好意思，我们知道，大家都非常向往听一听我们陈市长和来自上海的演讲嘉宾的分享哦，有点全场爆满，不太够意思。那我也代表这个主办方跟大家讲，多多包涵一下哦。And 那我们今天呢非常高兴出席第6届的新加坡上海城市治理高端对话论坛。那我在这里呢代表新加坡政府，也代表贸工部以及文化社区及青年部呢，就是欢迎各位来自上海的世界各地的朋友们，很高兴大家可以跟大家相聚在新加坡。我知道中华总商会会长也是刚刚从海外赶回来，一定要见到我们的陈市长哦。为什么呢？因为新加坡和上海呢有着许许多多的共同点。刚才我们在见面的时候也谈了。那作为各自地区的金融中心、经济和创新中心呢，其实新加坡和上海在维持开放包容的经济、推动城市绿化和数码化、城市治理以及环境保护和可持续发展方面呢，有着共同的发展重点。在许多领域都能够互相的学习、互相的借鉴、分享经验。那新加坡上海全面合作理事会 in English we call it SSCCC， 自2019年成立以来呢，不但加强了新加坡和上海包括 长江三角洲地区更多的双边的商业和投资的这个活动，也促进了双方在许多领域更深入的合作，以及更紧密的人文交流。那我记得去年4月的时候呢，我陪同唐振辉部长，因为他是联席主席跟公正市长，我是副主席，那我们就接待了公正市长，而且去年的会议真的是收获满满。那今年1月份呢，担任新加坡上海全面合作理事会联席主席的唐振辉部长呢，和担任联席副主席的我们俩都非常高兴有机会又到了上海，拜见了公正市长、华源副市长，也和几位上海工商业界的领袖们见面。那我们非常高兴看到了两地的企业携手合作，一起应对共同的挑战，把握新的契机，一起进军未来经济新兴领域。那我们刚才就说到了我本身非常期待在多1个月后，就是7月7号的时候呢，到上海出席第5届的新加坡上海全面合作理事会的会议，一起探讨促进新中两国，尤其是新加坡、上海两地之间更紧密、更深入的双边的合作。那新加坡和上海有着许许多多能够互相借鉴的领域和机遇。新加坡上海城市治理高端对话论坛呢，是一个非常重要的年度对话和交流平台今天全场爆满就是见证让我们新沪两地呢对城市治理的课题可以相互分享知识和这个经验。今年的对话呢，刚才司仪有说到，不过我觉得应该重复一下，今年的对话将集中讨论建设健康城市以及可再生城市方面的课题。我们希望和上海市进行富有成果的对话，同时携手合作，共同建设和发展能够适应人口变化以及可持续发展富有韧性的一个城市的未来。那接下来呢，请允许我用英语详细的解说一下。Now, ladies and gentlemen, our urban infrastructure influences our lifestyle and also impacts the health and social needs of our people. And like many countries globally, Singaporeans are living longer. But we all know a longer lifespan is only more meaningful if it's spent in good health. And so a healthy city is not just about having many healthcare infrastructure. Yes, that's important. And also not just about having a strong and extensive network community care system. I think it's also going upstream. For example, we must adjust our urban infrastructure to empower active seniors to age independently and to live purposefully. Now, one of the ways that Singapore seeks to do this is through our public housing projects, a topic that I discussed with Vice Mayor Chen over the course of yesterday World City Summit. An example would be the Singapore Kampong Admiralty. Now, there's a reason why I'm highlighting this. Now, this is the integrated senior housing that Mayor Gong Zhen, Vice Mayor Hua Yuan, and I visited in April last year at the sideline of the 4th SSCCC. We spent about 3 hours there, because it's a huge compound and there are many interesting components in there. Because Kampong Admiralty is the first such development in Singapore. It was started in 2017. The apartments are designed and furnished with elderly-friendly features. In addition, this special housing development provides our elderly residents with a wide range of facilities. For example, social, healthcare, communal, commercial, and also retail facilities, including a hawker center, all under one roof. And the common areas and the facilities at Kampong Admiralty are also purposefully built to promote strong social support and community bonding. Even if the seniors are living alone, they are not socially isolated. Someone will look after them. In Mandarin, we say 远亲不如近邻. And this encourages the senior residents there to stay socially engaged and lead meaningful lives. And Kampong Admiralty is very popular with Singaporeans, and that's why, since then, our HDB, which is the Housing and Development Board, has gone on to build what we call the CCA, which is the Community Care Apartment in different parts of Singapore, to offer housing that comes with senior-friendly features and customizable services, customizable care services for the senior residents. So to create a city for healthy living, we need to move upstream to prioritize preventive care and not just to only look at downstream, care facility. Go upstream to prioritize preventive care and also to promote healthier lifestyle. And Singapore has implemented various initiatives leveraging on behavioral science and technology to nudge healthier behaviors with conducive physical and social environment. For example, we established the MOHT. And what is that? And that is the Ministry of Health Office for Transformation to lead the efforts in understanding the links between socio-environmental determinants and people's behavior, as well as health and improve outcomes. And I'm very pleased, and earlier on the MC did mention, but I think it bears repeating, I'm very pleased to have with us our MOHT colleague, Dr. Tan Meng Wei, joining us today. Now, she will be sharing of MOHT approach in activating the community for better health through the Healthier Precinct framework. And this is part of our overall goal to create a healthier Singapore. I think many of us will know Minister Ong Ye Kung has been championing Healthier SG, and this is an example of going upstream. Now, we are also very honored to have our Director General of Shanghai Municipal Commission of Health, Mr. Daxiang, with us, and I look forward to hearing from him. And I look forward to hearing from him about Shanghai's approach to healthy city planning and governance. Now, we talk about healthcare. I think it's important to also talk about regenerative concept. Planning for a healthy city is also synergistic to our efforts to decarbonize for Singapore's net zero future. PM Lawrence Wong announced that we will reach net zero by year 2030. In fact, we hope to peak before we need to reach net zero by 2050, and we need to peak before 2030. And actually, the earlier part of what I mentioned, going upstream, all these are not, in conflict with our net zero. In fact, actually, it can be synergistic. How so? Now, this green transition is no longer just an option. I think we have a lot of bosses, head honchos, 老板们, 陶给 in the room. It is no longer just an option, but it's a strategic shift necessary for our countries and for company survival and prosperity. Now, as we transform, regenerative design has become an important pillar of our green transition. Earlier on, Vice Mayor Chen Jian talked about how Shanghai has proactively regenerated their precinct and the whole province in Shanghai so that they can achieve more with less and reduce their carbon footprint. We also aim to reduce our carbon footprint through design and adaptive reuse of built environment, built infrastructure, and to enable greater resource circularity. Now, regenerative design is actually not new in Singapore. If you think about it, our colleagues in URA, that means the Urban Redevelopment Authority, and NParks, the National Parks Board, in fact, they have been driving long-term planning and conservation efforts to rejuvenate our city-state. Because as stewards of very scarce land and limited natural resources, they seek to fulfill our vision of being a city in nature. In addition, government agencies like the BCA, and that is the Building and Construction Authority, HDB, and PUB, which is the Public Utilities Board, they have specific sectoral policies and programs to restore nature in buildings, in urban spaces, and also in industrial estate. And some of these efforts, include the Green Mark Certification Scheme, Biophilic Town Framework, as well as, we call it the ABC Waters Program. What is ABC? It is Active, Beautiful, Clean Waters Program. Just to name a few, we have many others. So I think Shanghai has many other similar programs. We look forward to learn from Shanghai as well. So to accelerate our green transformation, we will continue to forge a closer collaboration and links across our city towards more sustainable future. Because our whole of society approach really sees the private sector and public sector working closely together, as well as the community and individuals coming together to change the way we live, work, and play in order to create lower carbon island state. And like Singapore, many cities around the world are actively fighting climate change, 气候变化. So to that end, I'm very pleased to welcome Deputy Director General of Shanghai Municipal Commission of Housing, Urban Rural Development and Management, Mr. Zhang Yonggang. Later on, he will share with us about Shanghai's low-carbon city renewal and also infrastructure rejuvenation. They shared with us earlier. It's very exciting. You must hear from him firsthand. Envisioned as a people city, Shanghai has, through urban renewal and governance, implemented place-based approaches to foster and promote low-carbon and healthy lifestyle amongst their residents. And low-carbon renewal is integral to achieving better public health and lower carbon emissions. Moves to create new community spaces and retrofit existing buildings are some of the green efforts we see today to achieve healthy and sustainable city living. So on the Singapore side, of course, we are very happy to have Mr. Patrick Yap, representing the Singapore Green Construction Development Alliance, to share about Singapore healthcare sustainable design strategies. So in closing, Vice Mayor Chen and our friends from Shanghai, ladies and gentlemen, I think we are in for an exciting program. We look forward to a very, very fruitful discussion. Please do not leave Suntec after the program is over. The real business happens after that. Please scan your Weixin or scan your digital card. Make friends. I think we have a lot of friends from Shanghai. Do spend some time to get to know each other. That's the reason why we organized the 6th Singapore-Shanghai Dialogue for you. I wish everyone a fruitful discussion. May you gain fresh and valuable insights from today's dialogue. And I hope many new partnerships will be forged as we seek to make Singapore and Shanghai healthier and regenerative cities with a bright and sustainable future. 我在这里代表我们新加坡政府和代表贸工部，祝愿大家能够从今天的对话当中呢，收获满满，收获新的学习和新的发现，一起共同为新加坡和上海建设更健康、更可持续发展的美好未来。感恩，谢谢大家。
Thank you, Senior Minister. Please take a seat. May we invite Vice Mayor to give his opening address. Vice Mayor Chen, please.
"尊敬的刘月玲部长、女士们、先生们，同样我也要说抱歉，让大家久等。很高兴与大家相聚在美丽的狮城新加坡，共同出席第6届沪新城市治理高端对话。首先，我谨代表上海市人民政府，向主办、承办单位的精心筹备表示诚挚的感谢，对与会嘉宾的到来表示热烈的欢迎，对沪新城市治理领域取得的丰硕合作成果表示由衷的祝贺。中国高度重视城市治理和可持续发展。习近平主席先后提出全球发展倡议、全球安全倡议、全球文明倡议，提出打造宜居、韧性、智慧的城市愿景，充分表达了推动和加快落实联合国2030年可持续发展议程和新城市议程的诚挚愿望。2019年11月，习近平主席考察上海时提出人民城市人民建、人民城市为人民的重要理念，就做好城市工作做出一系列重要论述，为我们探索城市治理新模式指明了方向。比如，习近平主席提出，城市是有机体，是生命体，要像爱护眼睛一样去爱护城市，要像绣花一样去治理城市。城市治理是沪新全面合作6大重点领域之一，关乎民生福祉，关乎两地永续发展。去年4月，在沪新理事会第14次会议上，双方达成共识，推动沪新合作高质量发展。4月，新加坡时任副总理黄循财先生回访上海，与陈吉宁书记、龚正市长进一步共商沪新发展大计，标志着在全方位、高质量的前瞻性中新伙伴关系定位下，沪新合作进入新的历史阶段。今天， 我们在这里共同举办互新城市治理高端对话，正是落实互新合作新共识，探讨城市治理新方案的重要举措和具体行动。上海是中国最大的经济中心城市，是一座拥有2500万常住人口的超大城市。作为人民城市重要理念的首提地，我们正在以习近平主席关于城市工作的重要论述为指引，坚持走中国特色城市发展道路，加快转变超大城市发展方式，在人民城市建设上迈出更大步伐。我们将始终践行以人民为中心的发展思想，更好地彰显城市的人本价值，坚持把最好的资源留给人民，用优质的供给服务人民，以海纳百川的胸怀吸引人、成就人，让来到上海的人们充分感受到这座城市的开放、创新、包容，生活更有品质、更有尊严、更加幸福。我们将着力打造健康城市。作为中国医疗资源最为集中的城市之一，上海正在加快各级各类优质资源的均衡布局，促进居民健康，倡导简约适度、绿色低碳的生活方式，努力形成体系完整、运行高效、富有韧性的现代化卫生健康实施网络，建设全球先进的公共卫生安全之城、优质健康服务共享之城、医疗科技创新策源之城。我们将有序地推动城市再生，坚持把城市作为生命体、有机体，用科技更好感知城市的生命特征，像绣花般精细管理城市，以数字化、智能化赋能城市管理的现代化，实现城市空间品质提升，城市文化充分彰显，市容市貌焕新，让城市更健康、更安全、更有序，更加充满生机与活力。女士们、先生们，上海与新加坡同为国际大都市，文化相近，民心相通，有着广泛的合作基础和良好的交流传统。新加坡在城市治理方面有诸多的成功经验，值得我们学习。在此，我热忱的期待与新加坡的同事们开展更高水平、更广范围、更深层次、更为经常的交流与合作，为两地人民创造更加幸福美好的生活。同时也热忱的期待各位专家、各位嘉宾聚焦健康规划和城市再生，分享更多独到的见解，提供更多精彩的案例，为互新合作和全球城市治理发展贡献宝贵智慧。最后，诚挚的邀请各位嘉宾有时间到上海去走一走、看一看，感受这座城市的变化、生机与活力。预祝本次对话取得圆满成功，祝大家身体健康、工作顺利、生活幸福。谢谢大家。
Thank you, Vice Mayor. Please take a seat. We will now begin the first presentation of the session. May we invite Director General Wen to give his presentation on Shanghai's approach to healthy city planning and governance. Director General Wen, please.
"尊敬的刘部长、陈市长、各位专家、各位朋友，大家下午好！非常荣幸在去年4月份陪同公正市长到新加坡访问，并代表上海市卫健委与新加坡签订了 医疗卫生战略合作协议以后，今年再次来到新加坡参加城市峰会。今天下午，我将用10分钟左右的时间，向各位来宾和同道简要地介绍一下上海的健康城市建设的有关工作情况。上海一直致力于落实健康中国的战略，来推进健康城市的建设。大致我们有5方面的具体的做法。首先，还是注重战略的引领和政策的制定。在2003年开始，上海就制定了叫健康3年行动计划，至今已经开展了第6轮了。同时，在2019年又实施了健康上海2019到2030的行动计划，全面来提升城市的健康水平。这涉及到全上海的40多个政府部门和16个区。在2021年度又印发了叫关于深入推进爱国卫生活动的实施意见，特别是在2023年通过地方政府立法，我们颁布实施了上海市爱国卫生和健康促进条例，从法律的层面进一步加强健康城市的各项工作。第2方面，我们主要的做法是注重社会共治。从2005年开始，上海市是在全中国首先成立了叫健康促进委员会，这是在市级层面。同时16个区也相应成立了健康促进委员会。到了2016年，上海市也是中国首个建立了省一级的叫健康促进中心。在2021年底，全市的37家市属的3甲医院和400多家公立医院都全面成立了健康促进委员会，所以把整个国家和市委市政府的健康促进的所有政策，在医疗机构内也全面的进行推广和落实。在2019年也组建了上海市健康行动的18个专项行动组，这里边包括我们对民众市民的健康知识的科普宣教，包括合理的膳食以及控烟、慢病的管理、传染病的防控等等18项专项行动。在2016年的时候，也在上海成功地举办了全球第9届健康促进大会，并在这个会上发布了上海宣言和健康城市的上海共识。第3方面，我们主要开展是叫优化健康服务。上海市一共大大小小各级各类的医疗机构有6500多家，其中大约3300多家是非公立的，也就是说我们叫 private hospital， 3200家是公立的。那么但是整个上海医疗保障体系所有的工作80%是由公立的医疗机构完成，这里边主要是包括了37家市级层面的3级甲等医院和145家各个区属的公立医院。另外，上海也建成了比较扎实的基层的医疗保障的体系，主要有247家社区卫生服务中心，以及近2000家卫生站和乡村卫生室，共同构成了一个3个层级的医疗保障体系。除此以外，上海也是一个老龄化非常严重的城市，60岁以上的老人是超过550万，所以我们在上海大力的推进老年人的家庭医生的签约服务。到目前为止，我们60岁以上老年人当中，已经有483万老人都已经和家庭医生实现了签约服务，达到了90%。这是对老人的一个健康照护的非常重要的举措。另外， 我们也特别关注特殊人群的健康保证，比如危重孕产妇、新生儿。在上海建立了由7家3级甲等医院构成的一个危重孕产妇的抢救中心，16个区也都有各自的妇保院和机构来对孕妇整个从怀孕到分娩出生全过程的健康管理。另外，上海也建了6家儿童新生儿的抢救中心，这样对一老一小以及孕产妇等特殊人群构建了一个医疗保障的体系网络。第4部分，我们主要的做法是美化城市环境。这个上海啊，主要通过2方面，一个叫城市更新行动。上海原来有很多老旧城区和城中村，近20-30年来在不断的进行老旧小区的改造。比如就在去年1年，我们就成功改造了老旧小区将近42万平方米，城中村10个。另外也在不断改善上海市民的居住条件。刚才陈市长上午在报告中也介绍，30年前上海市的这个人均的住房面积是6.6个平方米。那么过了30年到今天，上海市人均的住房面积已经达到了37.6个平米，得到了巨大的改善。另外，上海也在尽力的推进叫美丽乡村建设，因为上海16个区有9个区是属于 countryside 的，是乡村地区，但是一直在打造我们叫美丽乡村建设，累计已经建成了309个美丽乡村。同时，上海也为了所有的市民和居民，在建设叫15分钟社会区的生活圈行动。什么意思？就是指让所有的上海的老百姓在他居住地15分钟步行的这样一个范围内，他能够有很好的银行、超市、教育、医疗保障等等所有生活服务的体系，所以构筑这样一个叫15分钟生活圈的一个体系。在美化城市的另一方面，全市也在尽力的建设绿地和公园。上海因为面积不大，但是人口众多，全市的各类公园目前已经建设达到832个，建设的街心花园和这个 Pocket Park 就是口袋公园，城市的小的绿地已经有476座。上海市目前的城市森林的覆盖率逐步增长到了近19%。还有我们的人均的体育场所也在不断的增加，无论是室外的场地还是室内的运动场馆。目前上海市的人均的体育场地面积是达到2.51平方米，市民健身的步道达到近2000条，特别是黄浦江和苏州河，上海的2条母亲河，它的两岸分别在2017年和2020年实现了黄浦江和苏州河两岸的全部的步道贯通，分别达到45公里和42公里。那么这些2条河的两岸的步道，人们可以在那边进行这个就是叫健身行动，可以跑步，可以骑自行车，大大的这个方便了这个居民的这个生活。另外呢，就是第5方面，就是我们也在不断的致力于提升，就是这个老百姓的叫健康的素养。一个我们连续15年的时间，向这个所有的这个老百姓进行科普的健康的宣教，累计是发放了1亿多份的健康的知识的读物和宣传手册。另外呢，就是我们也建立了将近4万个健康管理小组 让所有的群众动员起来，以家庭、以街道为单位进行健康的自我管理。同时，我们与所有的媒体加强合作，来构建了这个科普的频道啊。另外，在上海也举办了3次我们叫健康脱口秀，就是让所有的医生、护士、公共卫生等医务人员通过 talk show 的形式来对所有健康知识和疾病的防护预防进行宣传我们办了3期，前2期是在上海市范围，第3期已经扩展到全国范围的一个脱口秀的大赛这个节目收看的人次超过了28亿，起到了非常好的一个健康宣教的作用。未来上海市肯定还是要继续在城市健康的这个道路上继续努力。现在上海市在中国来说，应该说它的这个市民的健康指数的综合排名是排在中国的第1位健康服务和健康产业2项指标在中国也是处于第1而且呢，实现了16年的这个市民健康的整个水平的不断的提升，现在的健康素养指数已经达到了40.45%。另外，我们也是在中国大陆在省一级的这个区域中率先这个实现控烟法成人的吸烟率呢连续12年呢下降去年应该是降到了19%但是吸烟的人还是不少上海的这个3大健康金指标，就是我们叫平均期望寿命、新生儿死亡率和孕产妇死亡率多年来一直保持世界发达国家的水平。平均上海的现在平均期望寿命是83.2岁，女性是85岁多，男性是80岁多。另外，这个新生儿的死亡率，上海是2.1%那个孕产妇死亡率是2.6%而且多年一直保持在这样一个比较高的水平那么从未来来讲上海也有很多挑战，就像我们刚才陈市长提到，第一，人口基数非常大，有2500万的常住居民，而且呢，老龄化非常严重。上海60岁以上老人按常住人口算，这个比例已经达到26.6%。如果按照户籍人口算，老年人的比例已经达到36.8%。也就是说，1/3上海户口的老人都是居民都是老人，所以这给我们的整个健康保障体系的建设带来巨大的压力。我们未来可能从3个方面将继续努力。第一个，要增强城市的安全和韧性，就说统筹我们经济社会的发展和城市的安全这个提升应对公共卫生以及突发事件和重大传染病的预警、防控和处置还有我们是进一步提高城市的智慧化和数字化的治理水平。我们把人工智能今后要挖掘更多的应用场景，尤其在医疗卫生健康的领域。比如我们对老年人的高血压、糖尿病等慢病管理，因为人口太大，我们的家庭医生负担很重，一个 family doctor 要签约2000名以上的老人，所以我们现在就充分利用人工智能这个语音识别系统让那个通过人工语音的一个随访系统，这样把家庭医生从繁重的电话随访慢病管理的工作当中解放出来所有老年人对这个虚拟医生的回答的问题，我们都可以自动转换成文本，他的血压、血糖测量的数据都能够自动采集，变成一个数据，而且有一个有一个趋势对它进行随访，这是举一个例子。另外呢，我们还是进一步会加强叫整个健康的叫共建共享，我们会充分的动员和发动社会、家庭、个人以及所有的单位和工作的这个企业、事业等等，来参与到健康上海建设，形成叫健康上海人人行动、 人人受益的这样一种社会共识。我就简要向各位嘉宾介绍一下上海的健康城市介绍情况。我们几次来新加坡，也从新加坡的医疗卫生的保障体系，从你们的这个家庭医生的服务内容，以及像 General Hospital 这样大型医院的这个医院管理方面，学到很多好的经验和知识。衷心希望我们上海和新加坡两地医疗卫生的管理者和同道们能够在今后加强交流与合作。新加坡在上海也有一些好的医院，有投资，有开设。像今天我们来福士医院在上海也是我们的非公医疗的，就是 private hospital 当中是质量水平非常高的医院。我们也会一如既往的关心支持好有国际不同国家在上海投资办的医院。好，我就分享这些，谢谢大家。
Thank you, Director General, for your sharing. Please take a seat. For the next presentation, may we invite Director Tan to give her speech on Singapore's health and aging effort. Director Tan, please.
Good afternoon, SMS, and good afternoon, Your Excellency, Mayor Chen, and distinguished guests, ladies and gentlemen, and friends and colleagues. Early on, we heard from Professor Wen, right? Shanghai, just the aging population, 5.5 million. In Singapore today, are we there, right? Just the whole population. So we are just tiny little dot, right? So early on, I think Professor also shared quite a bit about the whole Shanghai's the plan in terms of the healthy Shanghai. I won't be talking about the whole plan in Singapore, because we have MOH looking into equivalent health promotion board looking into that, and MOH looking into planning for the hospitals, the number of hospitals, the hospital beds, the long-term care sector, the nursing home, day centers, and all that. What I'll be sharing is just a bit on what we are doing in terms of pilot, looking into how we translate all this national policy at the precinct level. So then we can see how does that translate, how does that impact the health of the individuals through activating the community so that they can take care of their own health. So I think, early on the share, SMS Law also share about Singapore in terms of our healthcare system. So we've been very lucky. We have a fairly good healthcare system, as many of you know. It's only about 6% of our GDP is spent on healthcare. But we know with the aging population, we're projecting that to be reaching almost 10%, right, in 2030. And that thanks to many of the very good and professionals and passionate and committed healthcare professionals, as well as our very unique healthcare financing system, the 3M, MediSave, MediShield, as well as MediFund. So MediFund is given to those people who can't afford. Then the government subsidizes them. MediShields, as well as the MediSave, are our individuals' savings from our daily, monthly kind of salary. So now we also have the universal coverage called CareShield Life. With that, though, we know with the aging population, Singapore will be super aged, right? In Shanghai, you're already about 33%. We will be reaching more than 21% by 2026, which is in 2 years' time. By 2030, 1 in 4, that is about 25% of Singaporeans, will be above 65 years old. Now, with aging population comes with a lot of other issues, right? Of course, we like to say, right, those of us who are above 60, I don't know how many of you, I'm 62 this year, right? We want to remain as active as we can, right? But we know the reality is there are some changes. There are 3 highs in Singapore. We call them san gao, high blood pressure, high sugar, and high cholesterol. Now, let's just see how many of you have one of the 3 highs. 你们哪一个有一个其中一个 high？High cholesterol, high sugar, high blood pressure? Yeah. 其他的那些年轻人当然没有了哈。Yeah. So I'm one of them, right? Yeah. so it comes with that, right? And with that, of course, then there are other issues. Then we have to deal with it, right? And in Singapore, the challenge now is our fertility rate is below 1%. Now, when you talk to many of the people, who are ready to be grandparents, they will tell you, my kids got married, but they're not interested to have kids. They have dogs and cats. So when they go holiday, I have to babysit their dogs and cats, So it is a trend of many developing countries, and that's a major problem. Now, the thing is, this year is the year of dragon. We know that in Singapore, every time the year of dragon, you have many more kids. So hopefully we'll go hit above 1% eventually, right? Yeah. And so with that, then what do we need to do? That's where the government is looking at how do we leverage on technology, data, as well as nudging the adoption of healthier behaviors and at the population level, just like Mayor also mentioned, right? Both in Shanghai as well as in Singapore. Now, we know that health is not equal to healthcare. Many people, when they talk about health, they say it's hospital. As our Minister Ong Yi Kang says, right? Health is not about doctors, about the professionals, but it's about you, me, and the community. And earlier on, right, Professor Wen also mentioned about that. So 60% of the health determinants actually is the social and built environments. And that is very important. That's where the healthy cities, the built environment come about. And in fact, our Health Promotion Board did a study. More than 50% of people say, yeah, I must adopt healthy lifestyle. But 61% of them are actually not doing so. They have sedentary life. They sit on the couch, take potato chips, watch TV, Netflix, and all the Chinese kung fu show, right? So the will is there, but the actual actions is not there, yeah? So then that's where MOH then decided that in 2018, they set up the MOHT, which is MOH Office for Healthcare Transformation. What we do is look at the system level, how we partners with the various community partners, the hospitals, the private sector, how can we accelerate system level changes that can help to bring about preparing for the aging population, preparing for the changes and the population decrease as well. So one of the things we do is to see how we could enable our partners design and validate solutions. One of the key initiatives we do is, because we are very small, by the way, we are only about 80 of us in the organization. So how do we then build the impact? So if you look at the health impact pyramid, for increasing population impact, you need, and with very little individual efforts, you need to push it down all the way to the base of the segment of society. Do things, for example, clean water. With clean water, we know that there is a lot of improvement in terms of people, instead of having cholera, instead of people having the problem, right? You could actually improve health. So one of the key things now we are doing is that how could we then do a healthy precinct based on the built environment, the social determinants, to have great impact on population health without using too much manpower? So what we did was about 2019, we get a pool of all the government agencies come together and look at what is a healthy precinct framework. And it is based on the 9 social environmental determinants that can affect the healthy behaviors. So that includes early on when Mayor talked about the green and blue space, it talked about community safety, it talked about health literacy as well. And what we then do is, interestingly, right, there's similarity. We then map this into the 3 main domains or segment where each of us will touch where we are staying, whether it's the built environment, whether it's a community you're living with, or whether there are care and support system, which is like the hospital or the social welfare system. And with that, we then say, how do I activate the community for health? Getting them to be involved and taking charge of their own health. So for example, at the environment, there are key elements like we are saying, yeah, I have a good built environment that is healthy. But what does that mean? So that means at the precinct level, you actually have the environment that is walkable. In Singapore, it's so hot, right? So a lot of Singaporeans always ask for the shades from their HDB all the way to the bus stop, from the HDB all the way to the market. There's a reason for it, right? Because they can help to encourage them to want to walk instead of taking a motorbike or instead of taking car, they can walk. So walkability is one of the key elements. And the other part is if we want to prevent people being isolated, then you must have space, you must have social area where people can naturally socialize in the community. So socialization, social space is another area. Now, in terms of care and support system, while having enough hospital, enough doctors, enough nurses is important, but more importantly, we know the health and social integration must be there. A lot of times we in the healthcare tends to think that, oh, this is social issues lah. You know, they're going to deal with it, the family, you know, they don't have money, go to the social worker. But the reality we know, right? It is not just about me as in looking after the illness, but also if I have no money, I will not buy medication. I will not go and see the doctors, right? And so we know that these are intertwined. So how do we ensure there is integration across health and social system? Now, in terms of community, earlier on, I may have mentioned about health literacy. When we tell people it's a healthy city, but half the people don't understand what is healthy eating. In fact, interestingly, when we did a study, we go around asking people in the community, and even including those people, seniors who are doing exercise, when they ask them, so why do you do exercise? They say, I exercise with my friends, spending time. But they can't associate that is actually to help them with their physical health. Yeah. So there's an improvement needed in terms of that. Now, later on, I'll explain to you a little bit of how we go about doing that as well. Now, to support all this, there are three enablers that we think is important. One of them is partnerships. Partnerships in terms of the individual, the communities, as well as the various agencies to coming together to support them. The other part is we also need to ensure that the people have the capability, and importantly, they must have data. Right? They must have data, and we know that now everybody wear this kind of watches, right, to keep track. So it kind of incentivizes you, oh, today I didn't walk 5,000 steps. So then you say, okay, I better go and walk some more, right? Up and down, you know? So that will help you. So data is important. And the other part we also learned is digital tools. We know that manpower, not enough, so we need digital tools. So how do we approach that? We approach that by doing top-down and bottom-up approach. What do we mean by top-down? Top-down is we work with the government agencies, for example, BCA, to embed health into their green mark for the building. So we work with various government agencies to ensure that whatever things they do, they consider health and not just doing it like sustainability. We know that climate change can affect health as well as mental health. So how do we increase their understanding of that? The other one that I was talking to earlier on, right, about previously I was involved in designing of nursing home for people with dementia. I have, I have an architect that asked me, you mean people stay in the nursing home can walk one? Because many of them don't realize people with mental health and dementia, right, it's cognitively, they are not there. Physically, they might still be able to walk, you know. So that's important for people to start thinking that way. And also, since we are working at the precinct level, we need to work with the precinct leader. For example, last Saturday, we just launched a Healthy Boon Lay, which is one of the constituency. And it happened the advisor is the Minister for National Development. And then we look into how can we mobilize the community to come together and moving towards a healthier Boon Lay. And the bottom-up approach then is we work with the community, whether you're self-interest group like Qigong group or whether you're people whom, you know, we get them to start talking about health, to come together and leverage on the existing social network. And of course, we provide them with digital tools. So Movement for Health is one of the key initiatives that we are learning to see how we could leverage on the existing social movements, existing social network, working with them to build a culture. So a little bit like a peer pressure, right? So for example, you work and then you go lunch with your friends. And if you see all your friends are eating salads and coffee without sugar, and here you are eating lots of meats and fat meats, you also feel a little bit bad, right? So, you know, that's one of the things that we are trying to do is that how do we use the peer pressure to create a culture to get people to start advocate and eat, right? When you hear that, wow, your neighbor running every day, you say, oh, maybe I should start walking as well, right? So that's what we are trying to do. And just to give you an example, we don't do health literacy through just education in terms of attending lecture, because we know, right, me as a pharmacist, I can tell you, 20 minutes, you go out. After that, you remember 5% of what I tell you, right? So, but what we do is we do it in their practice. For example, our community movement champion, Green Nudge, they organize sustainability walk, meaning they get the seniors to go to the park to go and understand about sustainability. What then they do is, along there, there's socialization, there's physical exercises. Then what they do is they do a very simple thing. At the end of every walk, then they'll ask the seniors, okay, you want a drink, right? So if you drink coffee without sugar, I subsidize you. If you want to drink your usual coffee with lots of sugar, you pay yourself. So that way people will start learning, right? Oh, okay, so that's how you then embed that kind of practice into them. Now, in terms of digital tools, we also do very simple one to enable. So we know that in the community, our grassroots leaders, our partners, they have lots of resources. To encourage them to collaborate, we then map out in the area where the precinct where we're working with, what are the different kind of healthcare services, mental health services, social services. So then the partners can then know what each other are doing. They can also help their residents. Like, you mean you need to see this GP? Oh, we know this GP actually can also see people with mental health issues, right? So they can Google using these very simple apps that we have, and so that they can also communicate with each other. Now, the other one, then we look into how to ensure environmental are safe. Earlier on we mentioned. So we partners with SUTD, Singapore University for Technology and Design. They were commissioned to do a study on age-friendly neighborhood many years ago. They came out with the principles of what does that mean to be age-friendly neighborhood. We then translate and use their questionnaire and make it shorter and then make it into a structured program and use the digital tools. So with that now, we can then give the tools to our partners, to the grassroots leaders, where they can do a walk and seek feedback from their residents to say, hey, actually, from this route to that route is not very safe. I take this route, oh, your signage is so confusing. So they can get the improvement, and it has a structure. We can collect the data. Then we can, of course, present to all the precinct leaders and government agencies, say, these are the priority, perhaps, that you need to do. So we do simple digital tools like that to assist our communities. So with that, I'd like to thank all of you for listening, and I'd like to call upon, especially my fellow Singaporean residents, together we can be aware, we can adopt healthy lifestyle, and we can advocate for healthy movement for health. Thank you.
Thank you, Director, for your sharing. Please take a seat. May we invite our next speaker, Deputy Director General Zhang, to give his speech on Shanghai's low-carbon city renewal and infrastructure rejuvenation. Deputy Director General Zhang, please.
尊敬的刘部长、陈市长、各位来宾、女士们、先生们，很高兴参加今天的沪新城市治理高端论坛也非常高兴荣幸来跟各位分享上海黄浦江、苏州河这两条母亲河蜕变重生的故事介绍上海在推进滨水区域更新当中的一些实践包括这个实现我们水源复兴方面的情况。大家都知道，我们人类都是逐水而居文明呢也是伴水而生，城市也是依水而建。黄浦江和苏州河作为上海的母亲河也见证了这座城市的诞生、成长与繁荣1843年上海开埠以来，一江一河作为上海这座城市的核心资源和历史文脉，一直引领着中国现代化的经济和这个文化的发展180多年前，我们一江一河两岸开始成为商船云集中外贸易的大码头大家都知道，我们中国最早的水厂、电厂、煤气厂都建在我们这个黄浦江的边上苏州河呢也见证了我们民族工业的发展以前我们的纺织厂包括我们的这个面粉厂很多都建在苏州河的边上。尤其是1949年以后更多的工厂、码头和仓库都在依水而建。那时我们一江一河区域应该说是我们城市重要的生产区域。但是随着发展，尤其是从上个世纪90年代末开始大家都知道我们乘着改革开放城市在快速的工业化同时呢很多企业都在向城市的郊区在延伸 我们一江一河滨水区域呢进入了发展转型的阵痛期。随着产业转型，我们沿岸地区大量的工业仓储开始停业闲置，苏州河呢也因长期的环境污染而导致了水质的黑臭。大家都知道，我们上海的苏州河以前实际上是相当于下水道一样的。我们苏州河跟黄浦江交界的地方两种河水的颜色是不同的。黄浦江是黄的苏州河是黑的这个泾渭分明当然现在都一体了所以说我就觉得滨水空间一度成为环境污染、业态衰落、人气凋零的城市的边缘区域。那么对长度近100公里、规划范围我们300多平方公里的超大城市核心滨水区如何进行产业升级、空间重塑实现水岸复兴是摆在历届上海市政府面前的一道重大命题。我们现在呢一江一河这个滨水区域我们有个条例，我们呢整个区域呢有340平方公里是在我们一江一河的这个区域范围里下。应该说这个上海着眼于满足人民对美好生活的新期待加快调整江河岸线的功能布局，大力推进沿岸的贯通开放，全面实施滨水公共空间的改造提升。我们有几个具体的做法一是呢就是坚持公共政策的引导，多方主体协同持续推动滨水区域的更新治理。1996年刚才也讲了，这个苏州河的水是黑臭的我们讲这个上海开始着手开展苏州河水质与环境的整治积极应对水岸的消极问题。20多年来，上海市政府所推动的持续推动的贯通开放，要还水于民、区域更新应该说创新性的解决了政策制度、规划设计、资源统筹维脉传承等诸多的难题。尤其是我们2001年上海发布了这个新一轮的城市总体规划所以说我们2002年开始，我们正式也启动了黄浦江两岸的开发，我们成立了专门的机构黄浦江开发领导小组办公室统筹推进相关工作，开始了沿江的仓储的工业仓储的动迁。应该说通过空间与功能的重塑，让滨江水岸地区重新回归了城市生活的核心。02年我们出台了一个上海市黄浦江两岸开发建设管理的办法最后呢我们还出台了一系列配套的文件，为滨江转型也提供了支撑。针对这个我们这个黄浦江两岸现状生产性企业和仓储用地的岸线为主的这个状况，我们还是多策并举打比如说我们对企业可以采用这个企业自主更新按照规划来实施还有一个呢与市场的开发主体约定我们滨江公共使用的要求公共事业的单位能够让渡公共空间、协议收储等方式开放和提升呢我们滨江的岸线。那么苏州河呢，大家都知道，因为这个两岸深入中心城区实际上在20世纪90年代的时候，以前很多的滨水区已经转变为居住功能甚至我们很多小区在这个批租的时候，把这个岸边其实也给这个居住小区了所以要贯通呢主要还是通过跟居民商量协商的方式来改造开放这个滨水岸线同时呢，刚才讲了，从96年开始，我们经过了4轮的苏州河的治理应该说实现了水清岸绿现在的苏州河完全不一样的我们很多的鱼虾很多的生物都回来了。2022年我们上海市黄浦江苏州河滨水公共空间条例出台了这也是我们上海第一步为公共空间制定法律制定条例应该说为我们滨水公共空间的长期建设、开放和管理提供了更完善的法治保障为此我们原来的滨江办现在我们城市在我们这个住建委有一个专门的处就叫一江一河处就是推进落实这个条例的贯彻实施我想呢这个第二个方面呢，我想我们上海在整个推进黄浦江苏州河过程当中滨水公共空间的更新过程当中，始终强调以人为本，坚持开放共享，营造生态绿色、舒适宜人、底蕴丰厚的滨水公共空间。2010年上海世博会的召开应该说极大的提升了黄浦滨江地区的影响力大家知道我们2011年上海这个世博会是在我们黄浦江的两岸召开的实际上也就是加速推进了黄浦江滨江地区的功能升级。那么苏州河的水质呢，那时候我们经过这个1996年开始整治3期的整治，已经由全线黑臭水体也达到了景观水体的要求。应该说到2015年前后 一江一河沿岸的主要区域啊，已经基本实现了从工业仓储岸线向生活性综合功能岸线的发展转型啊。实际上，一个城市的转型啊，实际上要经过若干年的努力啊。2017年底啊，刚才各位领导也讲了，我们实现了黄浦江核心区段45公里岸线的贯通啊。实际上，在这个过程当中，随后的几年我们一直在南延北拓啊。现在我们黄浦江两岸已经这个贯通的距离已经超过59公里了。2020年底啊，我们也实现了苏州河42公里岸线的贯通。应该说这个通过劈通岸线的断点，我们将原先的一些碎片化的这个绿地空间连成了一个整体。我们黄浦江沿线在贯通的时候建设了1200公顷的这个绿地啊。我们到这个2025年，我们还要增加400多公顷的绿地。苏州河两岸也传来了约150公顷的绿地和开放空间。在这个基础上呢，我们还植入了公共服务的设施不断提升环境的品质逐步构建了充分体现绿色开放共享理念的高品质这个滨水公共空间应该说这个同时我们在这个拓宽的过程当中，大家都知道我们上海是一个这个沿海城市实际上我们上海的这个海拔是比较低的所以我们这个防洪的要求也比较高所以我们一河沿岸地区在满足100年一遇防洪标准的基础上我们对这个滨江的断点和场地的高差也进行了精细化的无障碍设计以前我们到外滩也好，到苏州河也好，大家有时候站在江边，有时候看不到江的，因为我们的这个防汛墙很高所以说我们现在采取了2级防汛墙的一部分进行了设置对这个滨江的断点和场地的高差进行了精细化的无障碍设计构建了我们3道，也就是步行道、跑步道、骑行道合一的慢行系统同时我们也优化了沿河道路交通的组织尤其是垂河交通，就是怎么能够让老百姓能够很便捷的到达滨水区域应该说是一项非常重要的工作所以说我们讲确保我们的滨水公共这个空间面向公众的可达性、连贯性还有舒适性在这个滨水空间里头我们也植入了充足的便民的休憩设施包括社区食堂、轻餐饮车、直饮水点跑者驿站、24小时公厕等便民设施不断增加我们现在黄浦江苏州河的驿站我们将近100个100多个还在不断的增加同时呢，我们结合不同的公共空间的特点，也为体育、艺术、商业、游览等丰富的滨水活动提供开放场所大家都知道今年我们上海花卉国际节我们就在徐汇滨江我们设立了这个分会场我们新加坡园林也有做展示应该说吸引了大量的游客，在这个5一期间每天都有10万人流到这个现场来看所以说这个滨江的各类工业历史遗存也经过修复和再利用，也要转变为点亮滨水新生活的公共设施和景观装置，向公众提供了独特的文化和历史体验大家都知道我们很多的建筑很多的企业都是在这个历史的长河当中留下了我们深刻的记忆我想呢，我们在这个一江一河滨水区域也是，我们有分布有6处的历史文化风貌区63处的风貌保护街坊我们还有100余处的文物点，260余处的优秀的历史建筑，我们还有20余处的工业遗产我们通过一案一策进行保护修缮，创新方式加快促进活化利用尤其是我们在整个的动迁或者在整个的征收过程当中，我们也发现了很多新的历史建筑新的历史这个风貌点得到了及时的保护。一大批废旧的厂房也被改造为文化的博物场馆、时尚的艺术商业中心等功能复合体其中部分的改扩项目还获得了国内国际的大奖三是呢，我们聚焦核心产业，提升水岸活力，推动城市高质量发展。应该说高品质的滨水公共空间，完善的配套服务设施，为产业发展提供了强大功能。上海根据不同区段发展的基础和产业特点，整体统筹产业布局，在滨水重点区段布局具有全球竞争力的航运、金融、科创、文化等核心引领功能。你代表我们徐汇滨江我们这个徐汇滨江现在我们有6大组团在持续推进发展。我们这个北外滩，也就是原来的虹口滨江现在集聚了很多的航运企业 成为我们航运中心建设的一个重点。陆家嘴大家都知道我们是金融中心应该说黄浦江沿岸的我们现在形成了2个黄金三角一个就是原来的外滩陆家嘴，还有北外滩形成了一个黄金三角现在新的一个黄金三角就是原来世博举办的地方和前滩和徐汇滨江这2个黄金三角的核心功能区发展应该说非常迅速。苏州河沿岸的功能转型也持续推进，我们也打造了沿线，形成了一批的新兴区段应该说也在蓬勃发展。这个目前应该说我们滨水地区聚集了83%的上海的世界的500强企业，也就是重要的企业都聚居在一江一河的沿岸地区、滨水地区。文化、体育、娱乐业增幅也超过了400%，科技互联网行业增长20%到50%他们有统计的说创新型的企业应该是都是要沿水沿河比较容易这个创发人的创造力应该说我们一江一河带来了更加可持续的经济增长和财政收入更今后的一江一河从制造业外迁留下的工业锈带就是生锈的锈，逐步转变为今天的发展隧道锦绣前程的绣同时我们还紧紧围绕群众活动的需求积极策划公共性的商业、文旅、体育、艺术类活动聚集人气进一步增强区域的活力，实现水源复兴尤其我们现在特别注重水上运动我们这2天正在开展在苏州河上开展这个龙舟赛，我们还有上海赛艇赛，我们甚至还上帆上艇，沿岸呢我们开展马拉松等等的一系列的活动。以15分钟生活圈我们一直讲这个计算我们一江一河滨水区域覆盖了我们上海20%的人口，也就是480万人市民群众可以得到我们一江一河公共空间的服务。18年到2003年5年期间，我们滨江的休闲人口增长了171万人，增长率超过70%通过第三方的测评我们觉得63的受访市民反馈平均活动时间提高了半小时以上，因为你滨江空间特别友好，所以大家都愿意来，而且愿意待的时间更长一些，所以说大家的获得感、体验感明显提升。那么上海呢，正在加快建成具有世界影响力的社会主义现代化国际大都市一江一河滨水区建设也将持续推进空间提升、品质提升和功能提升，不断打造一江一河的新亮点、宜居宜游的新空间、人民城市的新地标我们相信应该说城市因水岸更美好生活因水岸更精彩，也非常期待和欢迎大家来上海感受这座城市的新变化新发展。谢谢大家。
Thank you, Deputy Director General, for the sharing. Please take a seat. May we invite our next speaker, Director Yap, to give his speech on architecture, design, innovation for the healthcare sector. Director Yap, please.
Good afternoon, dear Vice Mayor Chen, Minister Lo, guests from overseas and Singapore. Thank you for invitation to me to this Shanghai and Singapore dialogue of two cities that's close to my heart, because I have worked almost close to 50% of my work life 10 years in Shanghai itself. Okay, as a Singaporean that has worked in Shanghai this long, I'm representing RSP Architects and the Singapore Green Construction Development Alliances to share with you some of the things that I'm thrilled to share with you RSP insight on Singapore healthcare sustainable design strategy review. In our ever-changing world, stay informed, inspired is critical. And that's our goal today. Let's explore new perspective and idea and can make a difference, so that without further ado, let's dive in. Okay, I will start with an introduction of Singapore Green Construction Development Alliances itself. Singapore Green Alliance vision itself is to provide a comprehensive solution for sustainable green development in livable cities, benefiting lifestyles, nature and environment itself, promoting innovations in cooperation mechanism between enterprise in China and Singapore, establishing an exchange platform for promoting green development, integrating industrial resources through win-win cooperation mechanism, and promote the joint venture between the Alliance enterprise. 34 Singapore enterprise and other members of the Singapore Green Alliance itself focus on having green, The 34 members is supposed to focus on having green ecology, intelligent, health, and sustainable development home and abroad itself. Our main focus for today will be on health, sustainable, which is 持续性 within the city renewal context itself. Okay, the green, give me a minute. Singapore Green Alliance is our expertise on green transformation, demands, security protection, urban landscape renewal, business ecology upgrade. These capabilities are grouped under the green city, green buildings, green technology, and green tools. They are supported by more than 34 members, as I stated. RSP lead in the area of design itself. And for the BEI, which is the Building Enhancement Initiative, is about innovation practice for value enhancement of the environment, society, and market values itself. I'll do a RSP introduction, and I'll let my colleague.
人文赋予我们创造的一切，包括居住其中的使用者、设计所服务的社区，以及共同生息的生态环境。
We're a team that dissects problems to create meaningful spaces where design meets the real needs of humanity beyond the expected.
We want to influence our built environment because we all have a stake in it.
With an eye on the future, we are constantly looking at new technologies and design approaches to create icons that will stand the test of time.
Our rich and extensive multidisciplinary experience today means we understand cultures and places, using them to design a future where our world can thrive.
塑造地标，构建天际，我们憧憬着一个设计与人文交融并进的未来。
Okay, RSP is a global multidisciplinary architecture and engineering design group with over 65 years of experience building alongside Singapore. RSP just celebrated our 20th year in China itself. As mentioned in the video, RSP deliver humanity-centric design, 以人为本的设计 is our philosophy. As a one-stop design consultant with Singapore experience and expertise and all the ingredients that you can see in the Singapore city put together and present to the world from RSP 7 country offices working around 2,500 projects where design meets humanity. At RSP, we believe that health is not just the absence of illness. It's rare a balance between physical, mental, and social well-being. RSP Greater Health Concepts has delivered a range of innovative design from ambulatory centers to health hub, from acute to step-down cares that are first of its kind. As part and lead of RSP healthcare team, my design and operation experience has brought me to contribute across Singapore and Asia itself. Some of the China guests may be familiar with projects like Shanghai International Medical Center, 上海国际医学中心, 昆山西部医学中心 and 深圳第四人民医疗中心，这些都是我的设计。其实 ，OK， 这是前期的 ，OK， 到现在。我在换的就是一些 new concept on healthcare models like Thomson Specialist 专科的中心，在新加坡做。OK， 我大概介绍一下，就说接下来的一些新加坡的设计，就说理念的方面。OK，there are some Okay, these are some current health demographics of Singapore. Singapore is having a longer life expectancy. Early detection and prevention of chronic diseases and critical illness is one of the reasons. The proportion of Singapore aged 65 and above is rising rapidly, about 20% today, and by 2030 it's going to increase by another 5% to 25%. Singaporeans are living longer and healthier. The country investment on healthcare is rising and we need sustainable growth. Pandemic has created so-called panics around the world, and are we prepared for the next one? Okay, one of my favorite quotes from Virginia Satters, American author, clinical social worker, and psychotherapist. Problem is not a problem. Coping is the problem. How do we cope with problems itself? In the 24th edition SGH Annual Scientific Meetings in October 2022, titled Call for Action, Future-Proof Healthcare, a time when Singapore is slowly moving towards the next stage of pandemic control. The meetings call for raise for some points for us to take notes. Seizing the opportunity to transform healthcare itself. And one of the things that was mentioned was talking about ownership of one health well-being itself. The second part was talking about value-based healthcare itself. How do we deliver a collection of initiatives undertaken through healthcare system to raise the value of care provided through a selective of benchmark clinical and cost performance across providers from selected high-impact conditions. RSP, through our design, has shown how this has been done in Singapore with our partners. In every Singapore residence, East Coast Park holds a special and significant position in us. The iconic park is one of the Singapore's most beloved recreation place. East Coast Park was created in 1972, 53 years of history, a park created for reclaimed land along the coastlines. Going from East Coast Parks has been a monthly or yearly social and cultural event for some. This is the most visited park in Singapore, 7.5 million visitors annually. It's almost close to 1.34 visits per year if every Singaporean goes there. At the length of 15 kilometers connecting from Changi to Tanjong Ru, the distance is almost like Shanghai Renmin Guangchang up to Yan'an Lu and Waihuan, this distance itself, with an area of almost close to 2,755 mu di. It's a place to go for exercise, a place for health promotion itself. East Coast is divided into 8 areas, A to H, intertwined with neighboring township to provide social integration, melting pots where people from different backgrounds comes together, reflecting on the country's multicultural society. A platform that promotes physical, social, and cultural well-being. This is the 1970s Big Splash, I think, which is quite familiar to those who have saw this before. And from our China guests, it will be quite familiar for those that is in the construction industry or working on old areas when they say this is the 拆字, which is supposed to be demolished itself. To achieve construction sustainability, okay, to reduce the carbon footprint of the overall construction, time was spent to study the existing structure to understand how to reuse and integrate them into the modern design that RSP has proposed, resulting in reduction of construction times and costs. We adapt and reuse the construction and inject new culture into the site. We increase the accessibility of the entire sites by bringing more programs to allow more sustainable growth. By focusing on prevention, healthcare can reduce the frequency of diseases, lower treatment costs, and improve the overall quality of life. A famous Chinese phrase usually being said is 预防胜于治疗, prevention is better than cure. Next, I will show you a short video of the project.
was the former Big Splash, and what MParks wanted was actually to ensure that it's still a fun and active area for the parkgoers. We will try to retain the existing structures, so we retained that cylindrical form, and then as we developed the vertical playground within it, we were mindful of trying to get back the rainbow colors that it was associated with. We did a vertical playground with the spiraling ramp around it. That's about 2 slides that we catered for as well, just to give a nod to the old slides that were once there. Around the Coastal Playgrove Cylindrical Tower, we had various other activities for the families as well, which includes the water playscape, the nature play garden, the sand pit, and even an event lawn for future outdoor events. We really tried to pump in as much activity as possible within the node so that the public have something to look forward to and can see what East Coast Park can actually offer.
Okay, from here we move on to mental health. Number of dementia patients and the rate of growth in Singapore. As of April 2022, there's almost 92,000 people in Singapore living with dementia. The number is expected to increase to 152,000 by 2030, and by 2050 is close to 187,000. Dementia is a common disease in Singapore, affecting 1 in 10 over the age of 70, which is 10%. By the age of 80, 5 in 10, which is almost close to 50% of the population will have dementia. Okay. A Singapore-wide survey by SMU, Singapore Management University, and Dementia Singapore in 2019 shows that 3 in 4 living with dementia feels dejected and loneliness. 53% feels that they are treated less competent. Even 39% of the caregivers are having embarrassing public situation while caring, and so on. The project seeks to provide a warm and welcoming space for seniors to enjoy their programs within the museum and encourage them to further explore the museum building that its rich collection can support their well-being. National Museum, with a history date back to 1887, beneath the 19th century colonial exterior. The reunion space, a space that offers programs that leverage the potential of culture and heritage assets, with the aim of making a case for the museum, making social prescription, enhancing new social values into the National Museum, and also provide non-medical intervention for the seniors with mild impairment and dementia through the building enhancement initiatives. Designed to evoke a home, Reunion seeks to provide a warm and welcoming space for the seniors to enjoy programs within the museum and encourage them to explore the museum building and its rich collection that can support the well-being. Healthcare professionals and organizations are encouraged to host their senior-friendly programs at Reunion. The following will be a short video introduction of Reunion by the media. Okay, from well-being, we move over to value-based healthcare. In 2 separate 2004 speech by Mr. Ong Ye Kung, Minister for Health, stated, a major factor for rising healthcare costs is that we are getting old. And we are getting old and more likely to fall seriously ill. We are on the verge of a super age society. There's no micro numbers. affects individuals and families. And it says that there's an unbreakable iron triangle in healthcare. There's three aims for healthcare: affordability, quality, and accessibility. There are also trade-offs as such that improvement in one of the areas always come with the expenses of two other areas. He also stated that Singapore patients are now moving from 85% to 90% for public services healthcare, and from 15% it decreased to 10% for public, signaling a greater lean towards affordability, despite the potential longer waiting times for public specialists. A challenge was thrown to the private hospital management for new insights and ideas how to improve. In response to these changes, private sectors has responded. Integrated ambulatory surgical centers has emerged as a potential solution for transforming the healthcare landscape in Singapore itself. Integrated care across clinical and retail health touchpoint, supported by 15 doctors, Thomson Specialists, Woodley, will feature Thomson's medical strength in pediatrics, obstetrics, and gynae itself, providing over 10 different clinical specialists in the community settings itself, including one-stop access to day surgery to ambulatory surgical centers within the clinic of 450 square meters itself. Benefit of ambulatory care centers, from cost-effective to delivery streamlines outpatient to enhance accessibility, was something out of the three triangle that we were talking about. Evaluating patients' outcome and satisfactory. This helps the ecosystem of a support, ensuring that patients can access wide range of healthcare services and healthcare professionals at their doorsteps, including procedures that require day surgery. Will be a short video by Thomson itself to look through that whole development. A very small scale, but a very compact development. Okay, last but not least, step-down care. With Singapore facing an aging population where many aged need to be looked after, more elderly care centers and nursing homes are built. Nursing homes will be the key partners to MOH, and the number of nursing homes in Singapore has been increasing rapidly, from 77 in year 2020 to 83 in the year 2022. Singapore healthcare has always integrated public fundings with private service provisions to ensure broad access and efficiency. The PPP model is common here. SJSM, a history date back to 1971, 54 years. This project, the lease renewal was conditional. If SJSM would have built and operate a nursing home within its site, the lease will be renewed. If not, the church will have to return 2/3 of the land to the government to do so itself. SJSM project Spring and Winter is developed as an integrated multi-generation facility itself, as a building enhancement initiative project that helps create regeneration to the existing facility, fostering opportunity for intergeneration bonding itself. Built at a cost of 60 million at 273 beds, nursing homes that took 9 years to build, SJSM Village is a purposely built facility in Singapore that integrates various intergeneration facilities in one place. As we stated, 家有一老，如有一宝. But there's so many 老 and so many 小 here which they are helping each other to help them deal with what is it. So as I stated, let's get first-hand feedback from the users and the SJSM team to show how in a local media.
Hung around the new St. John St. Margaret's nursing home are the proud handiwork of resident Madam Lim Chor-hoon. The 79-year-old has called this place home for half a year now. She requested to move here after her husband passed away.
Quite okay, good. The nurses are very good.
She hasn't had the opportunity to interact with the children from the preschool next door just yet, but this is exactly what the new SGSM village is working on, regular interactions between the two groups from next year.
I'm happy to go. If the children come, I will happy to play with them, talk with them.
They actually could see medical benefits from the elderly having interaction with very young children in their facility. So we could see that there are benefits for the elderly health-wise, it's measurable, and there are also benefits for the children. They have become more mature, they become more used to what society is like, so they grow into that.
And these benefits could come from something as simple as having both children and the elderly exercise together.
On future directions and opportunities itself, as a summary. As the city expands, the original areas revolve into a core city with living organization. Okay, cities require ongoing maintenance and development to ensure healthy growth. Without this continual attention, urban functional deteriorates, leading to declines. Can city keep expanding? Are they still of manageable size? Expansion is subject to various limitations, challenges including factors such as available land, infrastructure, environment constraint, and socio-economic conditions plays a significant role. We cannot keep on building greenfield facilities. Through project shows, using opportunity to transform value care, healthcare, or foster well-being ownership, we have enriched the ecology with Thomson specialist support in community settings or creating regeneration to existing facility at SJSM Village. Cooperation between governments, industrial like Green Alliance, design professional like RSP is paramount in advancing the sustainable development itself. Building enhancement initiatives have shown that we have generated comprehensive solutions for sustainable green development in existing livable cities, benefiting lifestyle, nature, and environment, giving new values to cities' urban renewal process. Okay, thank you.
Thank you, Director, for the sharing. Please take a seat. We have now come to the end of the presentations. We would like to invite Mr. Yon Wen Tong, Director of Capability Development, Center for Livable Cities, to give the closing address. Mr. Yon, please.
Excellencies, distinguished guests, colleagues and friends， 非常感谢各位领导和嘉宾参会。为了更精准地表达我的感想，请容许我以英语继续发言。Thank you for taking your time to join us at the 6th Singapore Shanghai Dialogue on Urban Governance. I would like to take this opportunity to thank Senior Minister of State Ms. Ling and Vice Mayor of Shanghai Municipal People's Government Mr. Chen Jian for gracing this event. I would also like to express our appreciation to our presenter for sharing their insights on planning for healthy and regenerative cities. The Singapore-Shanghai Comprehensive Cooperation Council, or SSCCC in short, was established in 2019 with the aim of promoting trade, business, knowledge, and cultural exchanges between the two cities. Since then, the Center for Liberal Cities and Shanghai Municipal Council Commission of Housing, Urban Rural Development and Management have been co-leading the Urban Governance Work Group, one of the 6 work groups in SSCCC, which convened experts from government, academia, and industry and facilitated cross-sharing of urban policies and government's approaches through annual dialogues like the one today. Through our knowledge exchanges, we have witnessed collaboration between enterprise between Singapore and Shanghai, such as the MOU between Fengxian Development Group and Singapore Green Construction Development Alliance to collaborate on green and sustainable development in the Fengxian new city of Shanghai. I'm confident that our collaboration will continue to strengthen as we share ideas on how we can make our cities more livable, sustainable, resilient, and healthy, while creating more opportunities for industry collaboration and innovation. I sincerely thank our friends from the Shanghai Municipal Commission of Housing, Urban Rural Development and Management, and the Shanghai Health Commission for co-hosting this dialogue. Once again, thank you everyone for making this event a remarkable success. We look forward to seeing you at future events, and I wish everyone good health. Thank you.
Thank you, Mr. Yuan. May we invite you to stay on the stage. May we invite Ms. Xu Qian, Deputy Director of Shanghai Coordination Center of World Cities Day, up for the publication exchange. Thank you, Mr. Yuan and Ms. Shi. Please remain on the stage. We have come to the end of this session. May we please invite SMS Low, Vice Mayor Chen, and our speakers to the stage for a group photo, please. Thank you. Awesome pictures were taken. Today's session has been fruitful, and we'd like to thank the speakers for their comprehensive sharing on healthy and regenerative cities. From this sharing, we hope to continue to strengthen our collaborations and sharing between Singapore and Shanghai and continue the good efforts of our partnership. We'd like to thank everyone for attending this session. Thank you, Senior Minister Loh, Vice Mayor Chen, Director General Wen, Director Tan, Deputy Director General Zhang, and Director Yap for making this session a fruitful and wonderful one. For our audience members, please visit other WCS sessions and also our booth at level 4 for our publications and books. As you exit from the room, please place the receiver and the headset on the table next to the door. Thank you once again and have a fantastic evening.